Hello, I'm David. I'm an Egoscue therapist, and next up we're going to do supine progressive in tower. Okay, so to get into this position, we're going to get your left leg up on the block. Your left leg is kind of in that static back position. Yeah, that's it. Get right up against the block. Good. And the right leg is going to be in the tower. So what we're going to do, so what we've got is this right leg in this position. We've got the tower set up so it's straight. There's a direct line between her hip, knee, and ankle. What we're doing here is it's kind of like we're putting the hip in traction. There's a muscle group called the iliopsoas, which is one of the hip flexor muscle groups. And it's the only muscle group in the body to connect from the lower body, so from the femur through the pelvis onto the lumbar. And when it's in contraction, when it's not operating as it should, it tends to have big ramifications up and down the body. So by releasing the iliopsoas, we can tend to get a lot of mileage. That's why the tower tends to have such a big place in Egoscue therapy. It can take a little while. That's just because the muscles of the groin, the iliopsoas can just tend to be so stubborn. Muscles around the groin tend to want to be involved in everything, and they can really take a while to release. So we're going to spend 5 minutes on this first level. For some people, it might even take more. But we're going to say 5 minutes on this first level. Once that's done, we should feel a release. We should start to feel the lower back relax into the floor. And then at that point, we're going to go down to the next level. When we go down to the next level, let's do that right now. So from here, you'll notice some different notches on the tower. You want to make sure that the foot is in the same notch. So if one side is in the back notch, if your left side is in the back notch and the front side is in the front notch, and the right side of the pedal is in the front notch, you're going to notice that's at a diagonal. Want to have them in the same notches. Okay, so now we're down on the second level. We're going to repeat this process. We're going to release in this position. Now we've got this greater disparity between the hips. And we're going to keep on going down. So with this hip inflection, with her left hip inflection and her right hip in greater extension, we're going to keep on releasing at each one of those levels. We'll go down the next level. We'll release it here. We'll go down to the next level. And again, you're going to notice that the hip kind of tightens up. Over several minutes, we'll start to release. We then go down again until we get all the way to the bottom, and we find that the right hip is relatively released, and this left hip is in flexion, so we can have that disparity between the hips and not have this iliopsoas, this hip flexor, automatically turning on. The body works holistically, and that means that a dysfunction in one part of the body will tend to have an effect in different parts of the body. Often the side of the pain is generally not the side of the problem. But if there's a ground zero of the body, it's going to be the hips. So we want good functional hips, good functional hip movement, and this one is a great one to help with that. Of course, this one, you kind of need the tower to do it. Some folks trying to improvise using a step ladder, so you can give that a go if you like. But in order to keep the foot upright, really the tower is the go. If you are using a step ladder, you'll rest your foot on the step and you'll have a prop there to keep your foot straight. Then you'll go down to the next level. So this is supine groin progressive, and give it a go.